Hi there. Welcome to an exciting episode on the Conversations on Climate Change and Health, a long overdue conversation as we explore the intricate relationship between our changing climate and its impact on our health and well-being. Today, we're delving into a critical topic. Yeah, I know I'm always saying critical topic, guys. Just trust me on this. The intersection of climate change and health, as highlighted in the World Health Organization's COP29 special report. Now, if you've been here, you know how I always say climate change is not just an environmental issue. It's a health crisis. It's a defining challenge of our time that affects every aspect of our lives, particularly our health. In this episode, we'll unpack the key findings from the WHO report, discuss their implications, and explore how we can act to protect our health in a warming world. Now, let's start the basics. So, WHO emphasizes that the consequences of burning fossil fuels ripple through every determinant of health, from the food we eat to the air we breathe. Climate change directly and indirectly impacts our health, exacerbating non-communicable diseases like cardiovascular diseases, respiratory disorders, and diabetes. Now, these NCDs accounts for a staggering 41 million deaths each year, with climate change and air pollution contributing significantly to these numbers. I know, that's a staggering statistic. In fact, air pollution alone is linked to nearly 7 million premature deaths annually, with a large portion of these deaths attributable to NCDs. The burden on our health systems makes it even harder to achieve universal health coverage. In 2023, people faced an average of 50 more days of health-threatening heat compared to previous years. This increase in extreme heat leads to serious health risks, including organ failure and even death. With 71% of the workforce exposed to excessive heat, we are seeing millions and millions of injuries and 10,000s of deaths each year. The economic impact is staggering too. Over $500 billion potential work hours were lost in 2023 due to heat exposure, translating to an estimated income loss of about $835 billion. Yeah. So climate change isn't just affecting our individual health. It's training our entire healthcare system. Increased demand for healthcare, combined with damage to health infrastructure from extreme weather events, creates a perfect storm for health emergencies. In many regions, acute care systems are often weak, especially where climate impacts are felt most severely. And let's not forget about vulnerable populations. Pregnant women, for instance, face heightened risks of climate-related factors affecting maternal and child health. So when it comes to maternal health and child health, pregnant women actually face a lot of risks from climate change and air pollution, such as preterm birth, low birth weight and maternal death. And climate change also worsens food insecurity, affecting breastfeeding and maternal child health. When it comes to our children's health, trust me, children's health are arguably the most vulnerable to the impacts of climate change. And mind you, this effect will have a long-lasting consequences for them because early childhood is a critical period for their physical, cognitive, and emotional development, and is very sensitive to environmental and social disruptions caused by these climatic stresses. Would you believe if I tell you only 2.4% of climate finance incorporates child-responsive activities? In 2021, more than 700,000 deaths in children under the age of 5 were linked to air pollution, representing 15% of all global deaths in children under 5. The mental health implications of climate change are equally alarming. Now, thank you very much for joining us once again, and don't forget to send all your comments to climatehealthpodcast@gmail.com. Please do all to stick and stay with us throughout this episode. So in my last episode, we talked about climate change and mental health. Talked to an expert about that. Rising temperatures and extreme weather events can exacerbate pre-existing mental health conditions. Do all to go to my last episode, go learn more about climate change and mental health. So young people are particularly affected reporting rising levels of anxiety as they grapple with the reality of climate change. And we are projecting that the cost of mental health impacts from climate-related hazards could reach nearly $47 billion a year by 2030. So the report goes on to highlight the concept of loss and damage, which refers to the unavoidable impacts of climate change. This includes economic losses, as well as non-economic losses like damaged health systems and emotional distress. So now, what can we do? The WHO outlines several key priorities for health interventions at COP29 and beyond, which includes establishing a dedicated health work stream within climate frameworks to maintain focus on health impacts, quantify non-economic health losses and develop methodologies to address them, prioritize equity and inclusivity, ensuring vulnerable populations have a voice in decision-making, strengthen long-term supports for communities facing slow-onset climate events, innovative financing for health, such as global health insurance scheme for climate-vulnerable nations. We must integrate health considerations into climate policies to safeguard future generations. So it's very crucial for all of us, policymakers, health professionals, and individuals, to advocate for health-centered climate action. By prioritizing health in our climate negotiations, we can save millions of lives. Climate change is a health crisis. We must act now. Thank you for joining us today on Conversations on Climate Change and Health. As I keep saying, a healthy population is the foundation for prosperity. Please do well to share with others and stay tuned for our next episode, where we will continue to explore the intersections of climate change and health. Together, we can make a difference. Until then, I encourage you to observe the changes around you. How has your local environment changed over the years? And how might these changes be affecting your health and the health of your community? I'm going to say it again. A healthy population is the foundation for prosperity. Don't forget to send all your questions and comments to climatehealthpodcast@gmail.com. Thank you for joining me on this journey to understand the complex relationship between climate change and health. I'm Michelle Brokwa, and this is the Conversations on Climate Change and Health. Stay curious, stay informed, and take action. Thank you.